It is 10:51 a.m. on December 7th, 2020. First, I need to check the sound. Make sure that all the levels are adjusted. It's kind of like a sound check, you know? Testing, testing. I'm responding to a public comment that I put on the Federal Reserve website concerning proposal FR 4201 Market Risk Capital Rule, ICP 2019 14. And the comment ID is 134182, stated for June 7th, 2019. I read this recently, reread this recently. In this public comment, I reference another public comment that I had earlier filed on March 13th, 2019, regarding specifically derivative contracts and the use of derivative agreements. And then there were other things I talk about in here, specifically changes to the HHS system classification of data to information and other issues concerning changes to standards regarding human test subjects and medical experimentation, and changes to the Centers for Medicare and Medicaid Services around categorizations of risk as revenue for consideration by private companies and others involved with the financialization of healthcare services and provision before and in lieu of apprising patients or service recipients of their most basic rights concerning the use of their data or information in regards to various means by which risk is assessed or effectuated. This also comes in consideration of my concerns regarding the removal of the 10-year period for HUD deeds that instead focuses on a mere 1-year warranty for repairs that were provided prior to the closing. In the last couple of days, I've done significant research specific to Texas, which is where I'm located. And among the things that I learned is that in the early days of the Republic of Texas, around the time that Texas was discussing how it was going to engage with the United States, among the things that happened was, one, there was a 10-year period where Texas had a relationship with the United States Treasury around having a certain amount of money put into bonds that were supposed to be held by Treasury for Texas regarding any outstanding claims that might have been levied against the state of the Republic of Texas before becoming a state, and a requirement that people release the United States itself from any liability before being able to claim that. There's a significant contestation, but in the course of the matters related to that, one of the things that happened was that the federal government, the Treasury, decided to recharacterize the bonds. After it had already agreed with the Republic of Texas to a particular relationship, it recharacterized the bonds. And at the time, there is a lot of discussion by the Texas legislature, including in how it was networking with and communicating with other people in the state republic that it was engaged with, about what the implications were. There was a lot going on in the Texas legislature, as well as in regards to how it was engaging with the people of Texas around all of the myriad issues at work, but specifically, what did it mean that upon agreeing to become a state of the United States under the terms it did, which we're still dealing with, there was a specific agreement that it would be under a specific kind of financial system and a specific financial terms, and then after that had happened, the Treasury just decided that they were going to recharacterize it and didn't tell Texas. And then Texas had to respond. That's part of what is going on now, is part of a process I'm engaged with. There is a 40-year anniversary on a report that was released by the Office of the Comptroller of Currency regarding the railroad industry that comes due in February. And I'm still at work on that. I'm taking my time with it. I've mentioned that elsewhere. But the reason I bring that up here is because these changes to HUD and these changes to HHS were not publicly announced in the same manner that things connected to all of these concerns around COVID-19 are. We are saturated on a daily basis with all kinds of information or misinformation about all that is connected to alleged policy changes, expectations of our social behavior, what our alleged economic possibilities are, what the long-term implications are, what kinds of policies are under consideration, things that we normally used to do or we were told we needed to do at the time we made a formal engagement of a particular relationship with an entity, have now been impacted by changes because of COVID-19. Nothing even remotely close to that was done with massive major changes to programs like HHS and HUD, which, by the way, do not only impact people in poverty. They impact the entirety of society, especially in the way that assets are commingled for various purposes or that portfolios are developed with some sort of diversification of investment instruments. And there was nothing like this. There was no intensive public education about what does it mean to remove a 10-year period mandated in acquisition of a HUD deed and just allow a 1-year warranty. No discussion of that. There was also no discussion about changes that the Office of Comptroller of Currency made to its semi-annual risk report, mischaracterizing in one manner or another the information that had been available in the last 3 years during this time frame in which presumably we're all focused on COVID-19. There was no information, no consideration, no discussion, and no disclosure about what it means that HHS was making what could just seem like a one-word change regarding data as opposed to information. But when it comes to actual legislation and the implications of what these sorts of things mean and how they end up actually functioning in our financial system and how that impacts our possibilities, substantive changes like changing the word data to the word information have profound legal implications. Those one word changes have actually been the topic of entire Supreme Court cases throughout the history of this country, and in many ways that there's a very significant history, not just on the federal level, but on the state level, of distinctions between what something like the difference between data and information is when it comes to protected health information or when it comes to private information and or when it comes to concepts of what's considered to be confidential versus what could be made available to a public agency under the alleged auspices of there being some sort of public health emergency. Now, fortunately or unfortunately, I actually do have work experience where my job was literally to research changes to legislation that have profound implications about what it means to have a so-called emergency situation, a health pandemic at work, and then discussions about what kind of information versus what kind of data is appropriate for acquisition from people that might need health treatment or might need to access some other resource that may be impacted by a prioritization of emergency health services during a situation such as this. The difference between the word data and information is monumentally important, even without there being an alleged pandemic. This change went into effect in October of last year. Why? This has a material impact on what's happening now and how people are allowed to declare what we're allowed to have access to or what we're not allowed to have access to. Data and information also have a very substantially different impact when we're talking about healthcare treatment than when we're talking about the financial system. And that's exactly the crucial matter that was attempted to be addressed through this public comment to the Federal Reserve. In addition, there were changes to the Medicare and Medicaid services when it came to private contractors that were trying to contract with the Centers for Medicare and Medicaid Services. This whole process was in the process of coming into another stage last year that had been ongoing for several years prior to that, where concepts of risk associated with what otherwise would be evaluated in accordance with setting terms related to insurance policies and or potentially impacting reinsurance paradigms was trying to classify risk as revenue. How do we financialize and or how do we account for risk as income as opposed to what else? Well, before you can talk about what it means to recharacterize risk as revenue, you need to know what else risk entails. What else was risk before it was characterized as revenue? And what does it mean now? What does it mean now that we're in the middle of a alleged global health pandemic where every day we are bombarded and saturated with information about deaths, about people that have been infected? We've got metrics all over the place. That is somebody's revenue. Every time we go out and we don't wear a mask and risk that potentially we might be assessed to be at a higher likelihood of transmitting a communicable disease, that's risk. Who gets to count that as revenue? And if that's the case, why is it that we aren't allowed to actually have any say in what ends up happening with that revenue right now? Why is it that we are supposed to be in a situation where these other matters that could potentially have been considered in an overall understanding of capital market risk have all been collapsed into and consolidated around our response to this alleged healthcare pandemic? The thing is, in order to actually set a foundation for preparing an emergency response, if not an emergency preparedness and prevention paradigm, when it comes to early containment of, after early detection of, a potential airborne or communicable disease that can become a pandemic, there were certain things that would have had to have happened in a variety of sectors. The templates and the understandings of what these things were have been in circulation in the appropriate realms for over 10 years. But who had access to those at the incipient stages of a particular global commitment to address it in that manner that still has a job now? In emergency services, in healthcare, in what would be considered the frontline providers or even the so-called first responders. How many of us that were organized, presumably, in order to provide the foundation for an actual pandemic response, are in a position where we're actually providing a response to a healthcare pandemic? Or were we eliminated because that's not what this is? Are we talking about capital market risk? Who's the market? Which markets are we talking about right now? Which markets are at risk? So that's what the understanding was at the time. It didn't have to be this way. It didn't have to be this way. Because what was happening instead in the last 3 years was the material conditions were being laid for something other than a prevention paradigm around early detection of a healthcare pandemic or a health pandemic. What did we have instead? Well, risk as revenue. So what's the market and who's at risk? And that brings up the other public comment I put in here that at the time I understood would have a very profound implication whatever should happen. See, the earlier public comment I had submitted had to do with concepts of derivative agreements. And at that time, a lot of the other people who responded, I read every public comment that was presented along with that. And a lot of them identified themselves as end users of energy service providers or of energy services. Many of them were in the gas and oil sector. Some of them were in other sectors. They identified themselves as working with the end user. And how that impacted, how derivative agreements impacted their relationships with the people they were engaged with. Now, if you read my public comment and the consideration of the other things that are going on with other people and how they're presenting it, at one point in time it might have seemed, why would this woman be presenting information about concerns regarding fraud involving the Health and Human Services Department and the misuse of treatment for alleged healthcare and or other resource needs in considerations of derivative agreements? It's kind of where we're at right now. Short time ago, I attended one of these webinars. This is a big concern we have right now. Is people are being told while we're locked in our houses, somehow people get information about us and they start sending us emails. How did the people who got my information get my information so they could start sending me promotional information about these free webinars? Have you ever tried contacting them back and asking, how did you get my information? Have you asked them to remove you from the list? Have you said you've got misinformation about my identity information? I need for you to contact me about a correction. Have you ever attended those webinars? Have they ever provided you a bill? Did they tell you up front that these webinars were not free and that there were actual obligations associated with you actually agreeing to participate in what was otherwise advertised as a webinar at no cost? I believe that this is a ex post facto attempt to try to get people to accede to the understanding they've already agreed to what they've been doing for the last 10 years under the Affordable Care Act. That health treatment that we got wasn't free. Medicare and Medicaid weren't what was paying for it. Social Security disability insurance wasn't what was paying for it. Medicare for all is a misnomer. That's not what it is. We're not talking about a needs-based healthcare paradigm. We're talking about economic engineering under fraudulent pretenses. Now they owe. They made a big, big bet. Certain people did certain things in order to open up accounts, in order for the income, or rather the revenue, to finally be collected. And now, who's paying the bills? Who's paying the taxes? That's kind of where we are right now. Now, I hope that at some point, whatever else is going on today ends up kind of compressing and kind of addressing things on another level. It was completely disingenuous to fraudulently attempt to misrepresent that what was being provided was healthcare treatment, when what it actually was an attempt to recharacterize somebody as a liability that was actually incredibly productive, just because at the time they did not agree with their capital assets being invested in one sector or one political paradigm over another. You don't have the right to kidnap political opposition, torture them, and then tell them that they need to spend the next 10 to 20 years paying off the ransom in the form of medical treatment. And I'm sorry, I wish I could be more diplomatic. I wish it was better marketed for you. But it's not, because it wasn't marketing. It wasn't supposed to be branding. It wasn't supposed to be a corporate product. It was supposed to be engagement in ordinary political process. You did not have the right to kidnap political opposition, torture them, and then tell them they needed to spend the next 10 to 20 years paying the ransom in the form of medical billing and coding. You don't have the right to do that. And it doesn't matter how literal you make it with COVID-19 or how derivative you try to make it moving forward.